Hey, thanks for joining us. Today we want to talk about concussions. I'm Dr. Bozeman, and the question today is, what are concussions? And concussion is a brain injury or traumatic brain injury. You can come from a blunt force trauma to the head, or it can be from acceleration, deceleration. Think of you get shaken, your head gets shaken back and forth. And the reason being is if you think about your brain, it's a kind of a gelatinous mass that's protected by a hard shell around it, kind of like an egg. And if you shake it up really hard, you get a bunch of pressure gradients going back and forth, and that can cause injury to the brain. Now, concussion can come on with or without loss of consciousness. If you lose consciousness, that means basically you were knocked out. But there's variants of those. You can be dazed, and you can be kind of an altered state of consciousness, which is kind of classified as losing consciousness. You may lose temporal knowledge of time, things of that sort, and it can be really short-lived. But you can also develop a concussion without any immediate effects, and they can kind of start showing themselves a little later, a day or two later. And most common we deal with is post-traumatic headache, and the patient will present in, talk about how they were in a car accident. Maybe they were dazed after the accident, they hit their head, or they don't recall hitting their head. That's part of the wonders of amnesia, is you forget the events that lead up to the head trauma. But if you do have enough history that we can be concerned about head trauma, then you have a headache. We're going to check for central nervous system symptoms, which be nausea, vomiting, dizziness, blurred vision. You can have ringing in your ears. Some of the other cognitive things may not be coming to you as quickly. You may dizziness, confusion, irritability, having trouble adapt to the environment. You may have, you may be sensitive to light. You may be sensitive to sounds, and how you treat concussion and how you deal with it varies based on the presentation. And we work with many neurologists who do a wonderful job. And part of our role as chiropractors and Texas Healthcare and treating people involved in injuries, regardless the type of injury, is if you have concerns of traumatic brain injury or concussion, we're going to work to get you to the right specialist who can help you and help you recover. So thanks for joining in on this week's Ask the Doctor. We'll see you next week. Again, I'm Dr. Bozeman, and have a great day.